The CDC reported that nearly half of adults in the US have high blood pressure, which is also known as hypertension. That's over 170 million people with a blood pressure of 130/80 or higher. And 37 million US adults are reported to have blood pressure well over elevated levels at 140/90 or higher. Quote, uncontrolled high blood pressure over long periods of time can lead to serious medical conditions, unquote, such as heart failure, a heart attack, kidney disease, vision problems, or worse, a stroke. In many cases, the cause of hypertension is unknown. Therefore, treatment involves long-term management to control blood pressure levels. It's important to pay attention to symptoms, consult your trusted doctor, and seek the ideal treatment. Now, many doctors may recommend taking medications that may help or harm based on their side effects. Understanding the risks, benefits, and alternatives to the many medications could empower you to make the right decision. Here are 9 classes of blood pressure medications, their purpose, and possible side effects. Number 1, diuretics. Diuretics help eliminate excess sodium and water to help control blood pressure. They're frequently used with other blood pressure medications. Possible side effects of diuretics include potassium loss, electrolyte imbalances, dehydration, hypotension, increased risk of high blood sugar levels in diabetics, erection problems, and gout. Number 2, beta blockers. Beta blockers lower heart rate, workload, and blood output to reduce blood pressure. They are often used with coexisting heart diseases or arrhythmias. Possible side effects include insomnia, constipation, dizziness, slow heart rate, fatigue, cold extremities, cough, asthma, and sexual issues, including erectile dysfunction. A third medication class commonly prescribed for blood pressure is angiotensin-converting enzyme inhibitors, also known as ACE inhibitors. ACE inhibitors reduce angiotensin production, a hormone that causes narrowing of the arteries. This helps blood vessels stay open, lowering blood pressure. Doctors may prescribe this class for patients with heart failure and chronic kidney disease. Possible side effects of ACE inhibitors include dizziness, fainting, high blood potassium, dry cough, low blood pressure, and rare kidney damage. ACE inhibitors should not be used during pregnancy as they could be dangerous to the mother and the baby. Another blood pressure medication class that's used is angiotensin II receptor blockers, or ARBs. ARBs block angiotensin effects like ACE inhibitors, but often chosen for patients with dry cough due to ACE inhibitors, heart failure, and chronic kidney disease. Possible side effects of ARBs include dizziness, kidney damage, low potassium, and too low blood pressure. It's also commonly recommended not to be used during pregnancy. At number 5, we have calcium channel blockers, which prevent calcium from entering the muscle cells of the heart and arteries. This is often chosen by doctors for elderly patients and those with coexisting heart diseases. Possible side effects of calcium channel blockers include ankle swelling, slow heart rate, constipation, headache, and dizziness. The next class of blood pressure medications is alpha blockers. Alpha blockers relax the muscle tone of blood vessels' walls. This helps blood vessels stay open, lowering blood pressure. It's often chosen for patients with benign prostatic hyperplasia, or BPH. Possible side effects include fast heart rate, dizziness, low blood pressure, nasal congestion, weakness, and trembling. Alpha-2 receptor agonists are the next class of medication, which decrease sympathetic nervous system activity. It may be chosen when other classes are not well tolerated. Possible side effects include drowsiness, dry mouth, and rebound high blood pressure. The 8th class of blood pressure meds are medications that combine alpha and beta blockers. This class is commonly used for patients having a hypertensive crisis or used for patients at risk for heart failure. Possible side effects include a drop in blood pressure when standing up, fatigue, and low heart rate. The final commonly prescribed class is blood vessel dilators, or vasodilators, which relaxes the muscle tone of blood vessels' walls. This helps blood vessels stay open, lowering blood pressure. It's usually reserved for emergencies, heart failure, angina, or chest pain, and when other medications are not well tolerated. Possible side effects from the drug hydralazine include headaches, swelling around the eyes, flushing, heart palpitations, low blood pressure, and joint pain. The drug minoxidil is only used for severe high blood pressure and may cause fluid retention and excessive hair growth. Now, although it may seem that the only treatment options include medications, researchers are finding there are natural ways to help lower blood pressure. If you've experienced a blood pressure spike, ask your doctor about additional ways to reduce it with these 3 methods. 1. Stress management techniques. This can be mental health and physical exercises, including meditation and deep breathing. Research suggests holistic approaches to health can significantly improve blood pressure, heart disease risk, and quality of life. 2. Weight management. Weight management and physical activity are key to naturally preventing and reducing high blood pressure. Studies suggest obese and overweight individuals have high rates of resistant high blood pressure. Weight loss, maintaining a healthy weight, and daily exercise are linked to a lower risk of high blood pressure. And 3, diet and nutrition. Plant-based diets such as a vegetarian diet or a Mediterranean diet can lower blood pressure and reduce the risk of heart disease. Specific healthier foods include olive oil, high-fiber vegetables, fruits, and seeds. Omega-3 rich salmon, chia, and flax seeds, high magnesium bananas and avocados, garlic, pomegranate juice, spinach, coriander, cardamom, green tea, and beetroot juice. Now also, studies show that supplements like I-arginine, ginger, fish oil, omega-3, fatty acids, magnesium, garlic, green tea, and CoQ10 can help reduce high blood pressure as well. But please be aware that some supplements like CoQ10 may interact with certain medications, including blood pressure drugs. Check out our video on CoQ10 to learn more about the trending benefits and possible interactions. And make sure to consult with your healthcare practitioner before adding supplements to your routine. Now, after smashing that like button, watch our video with Allison Acera for more details about blood pressure dieting, and follow the link below for more resources. We'll see you next time.